You're listening to a brief excerpt from Solving the Rubik's Cube of Health Plan Benefit Design with Analytics, co-sponsored by Health Intelligence Company. During this webinar, officials from Health Intelligence Company discuss how healthcare data and analytics are being harnessed to design and deliver next-generation healthcare benefits packages and programs.
Good afternoon. This is Dr. Russell Robbins from Health Intelligence Company, and I'm joined this afternoon by Mary Henderson and Penny Monacle to talk about solving the Rubik's Cube of Health Plan Benefit Design with Analytics. What we will be discussing on this afternoon's webinar are the following topics: the state of the industry, mainly what are employers asking for and what are they seeking when they are looking for solutions. How are employers, brokers, and plans using analytics to shape benefit designs? What are some of the common frustrations with the current analytic solutions? And then we'll have a demonstration of a new tool, Wizen, which will show its ability how to address these frustrations, and then we will open the lines for questions and answers. Employers are looking for a variety of different things when they are looking for answers within the healthcare industry, from their benefits consultants as well as from the health plans that they are working with. How do they manage the high-cost claimants more effectively and efficiently? How do they identify them sooner? How do they get ways to manage specialty pharmacy costs? How do they deal with these types of trends that are continuing to rise on a year-over-year basis? How do they integrate all of this information into a culture of health at their workplace, making it that easier for employees to have ways of understanding how their healthcare costs are unique to them, but also how do they take responsibility and how do they improve the organizational health and decrease absenteeism and improve productivity? And what type of innovative solutions are out there to help them identify all of these different needs and opportunities, and how can they continue to improve and act on this for their employees? Employers are looking for ways to understand healthcare costs and using analytics to shape benefit designs. They're working closely with their brokers as well as with their plan sponsors, whether they're self-insured or fully insured, in order to understand how these costs are impacting them. So looking for emerging areas within the past and in the present, and hopefully into the future as well, for new procedures, new technology, emerging pharmacology agents for treating chronic conditions. They're also looking for ways to attract and retain employees through enhanced benefit designs. Some examples include autism coverage, infertility, as well as other areas to retain and attract employees. And finally, they're looking at ways of mitigating out-of-network costs by reducing utilization of out-of-network through plan design, or understanding what the costs are for out-of-network versus in-network, and using that for leverage and negotiation, in part to avoid surprise bills, or when those do happen, to give the employees the tools needed to understand the costs and use that for negotiation. In addition, employers are also trying to guide their employees to centers of excellence for elective surgery, changing benefit designs to sometimes even limit coverage of services to only the center of excellence for those specific procedures. They're also using this information to identify other areas of high cost and lower those as well. Finally, employers are looking at their current tools that they have access to, that their brokers have access to, and that their plans have access to, and recognize that they're spending too much time gathering and validating the data, that they have an inability to easily integrate this data, both the clinical and non-clinical data sources, as well as the limited ability to interactively analyze the employer's segments and compare them to national benchmarks. Even if they were able to do all of this, they find that there are so many steps needed to get to those steps, to get to that end process, that it almost becomes too cumbersome for them to do anything. And even when they get there, there's nothing actionable at the end of this whole process. And a lot of employers have been telling us that they feel that only data nerds are the ones who can get the information out of what their solution is out of the tool that they have access to. And so they're looking for a very simplified way to gain access to that information and not need a whole cadre of people to get them to that point. And now I'd like to turn the presentation over to Mary.
You've been listening to a brief excerpt from the Solving the Rubik's Cube of Health Plan Benefit Design with Analytics webinar presentation. This webinar was co-sponsored by Health Intelligence Company and recorded on December 12, 2019. The full webinar included an interactive speaker presentation with audience Q&A. You can watch the full webinar video by using the link that appears now on your screen.